Welcome to the College of Complexes. This is our 474th meeting since we started in February 2009. We put a speaker on every week, a different subject. We require a speaker to take a position on an issue or express a point of view. They have to be for or against something. We don't care what it is. We give them an hour to make a presentation. If they go over an hour, we cut them off. If anybody interrupts the speaker, we mind the interrupter. We listen only one fool at a time. That's one of our rules. Then we have questions and answers from the audience of the speaker, not speeches. Then we have remarks, rebuttals. Everybody in this audience that wants to gets 5 minutes at the podium here to respond to the speaker said, for or against. Our speaker gets the last word, gets the comment close the meeting. That's how it works. But before we introduce our speaker, we have time for announcements. Anybody have announcements they want to make? Now's the time to do it. Do you have one?
Yeah, I guess I got one.
Come on up here. Make your announcement.
Yeah. And Philosophers Forum is meeting again. We had our first meeting of this semester on September 10th, which was last Tuesday, I think. Our next meeting will be on the 24th. And I don't know what the subject is at the moment, but you can check our website, philosophersforum.org. You're welcome to come. We're meeting at Boca's Italian restaurant. So if you don't get enough Italian food here, you can go to a Boca's and get some more. But anyway, it's a good restaurant, good venue. We have lots of room for more people. So we welcome you to come out and have some intellectual stimulation.
Hey, aren't you speaking next week?
Here.
Well, tell us.
Well, I'm sure Tom would go over it, but I'm going to be speaking next week on my battle with the IRS. It's been going on for 6 years. And just for your information, I haven't paid a dime of federal tax for 6 years. And I'm still walking around.
We hope you make it here next week.
Well, next week we have. He gave it.
Yeah, I'll give a short intro.
Anyway, Ken Sauter will be talking about on his battle with the IRS. Should be good. I hope you're still alive to make it next week. On October 5th, we have Hexel, Colorado. He's Andrew Young, regional coordinator, regional organizer for North Texas. He's going to talk about automations here, the time for universal basic income, and Andrew Yang is now. Anyway, he's going to be talking about that. It should be interesting. Probably be a lot of furor going up over it. But anyway, it should be, you'll find out what it is.
What about Beasley? You skipped Beasley.
Oh yeah, Beasley. I don't have it on my sheet here.
Yeah, you do.
Yes, I do.
28th.
Oh, I missed him. September 28th, John Beasley. English-born author. He's going to talk about America, what went wrong. It's on your itinerary. I'm not going to read all this. It's on September 28th. But he's a very good speaker, so he'll be here. Then we go to October 5th. I missed it. Anyway, our speaker tonight is Dr. Daniel Herlihy. He's going to talk about his brain health and American medical crisis. He asked me not to read all this, because it's pretty long, so I won't read it all. I'll leave him do it. And anyway, he spoke here before. He had an accident about 12 years ago.
Yeah, exactly.
And it put him out of commission for a while. He lost his wife, his family, everything, and now he's recovered. And he's a doctor, and he was a doctor then, and he knows what he's doing. So anyway, he now works and he can tell you all about what happens to your brain when it goes wrong and what to do about it. Anyway, without further ado, please give a very, very warm welcome to Dr. Daniel Herlihy.
We lost the signal to the computer. I don't know why.
There it is. We're good. You got it back.
All right, we got it back. We're good.
One thing. How's that? Okay. Well, they come with a companion. This is Chewy. So Chewy, that's his second name, Chewy. But this isn't my companion. I must introduce Chewy, who wrote a book, Chewy, A Doctor's Tale. And we will talk about him in a minute. But you know what's worse than getting dementia? And I'm sure you know some people with dementia at your age. For the people that are looking at the recording, there's hundreds of geriatrics jumping up and down here. They're whistling. But there's thousands of them. So I'm sure they know a demented person. Okay? So let me tell you what my qualifications are. It's not that I'm a doctor. Not that I have an MBA in health. Not that I did 2.5 years of microbiology graduate work. I'll tell you, my major qualifications is I had a major traumatic brain injury, which I'll explain, from a car accident. And because of that, I'm in chronic pain. And chronic pain will make you crazy, just that, right? Additionally, now something you didn't know is that Alzheimer's, yes?
You're putting your hands on the screen and it's doing things.
Okay. Well, then I must be stupid. So what you didn't know is that Alzheimer's starts when? When have you noticed your friends getting Alzheimer's? How many years? Who knows? When is Alzheimer's? Ronald Reagan was in office. Did he have Alzheimer's? Yeah. He definitely had Alzheimer's. Alzheimer's starts 20 to 30 years before clinical symptoms. So, this pretty visage, you're looking at the face of Alzheimer's. There's a good chance that I'm already in the early stages, so I'm pretty invested in this business, right? And what I wanted to do was be against the traditional medicine, the traditional medical tradition, and for, if I have to make it black and white, for more out-of-the-box thinking and more what's called functional medicine, which used to be called complementary and alternative medicine, which you know as hippies, probably, right? So, I'm going to tell you how I got better, and if I can get better from a really serious dementia, then maybe that says something about your brain health. And at any age, people can improve. And there's a new thing on the horizon called, 7 years ago we discovered the brain is plastic. Do you know what that means? Okay, good. At any point in your life you can improve your brain. But let's make this fun. Let's play a game. I still have neurological deficits. And if you can spot them, the person with the most neurological deficits will get a prize from Chewy. So watch the speaker. Oh, great way to get you guys pay attention. And then if I do this, it means I made a joke. Sometimes I have to warn people. Okay, so what I want to do is kind of compare to Alzheimer's, which I have EPO4, the genetic thing, and my TBI to general brain health. Does that make sense? So let me just take you through, let's see. Let me take you through, let me tell you what I really want you to know, okay? I really want you to know that I don't think traditional medicine is good for chronic diseases. Nor do I think it's good. I'm really a little bit angry about that, okay? There's this thing called standard of care in Texas, so it's basically, I gotta prescribe, cut, or burn. It's just not the best for brain health. I've prescribed in my lifetime at least 250,000 prescriptions. So traditional medicine is great for certain things, bad for others. The other thing I want you to know, and it's your body. All right, you got to know whose damn body it is. It's your body, not the insurance companies, not the government's Medicare, and certainly it is not the doctor's body. It's your body. So you've got to stand up to him or her, right? I think it's real important to explore medical traditions that are currently outside the traditional realm. Okay, it's super important to do that. And if my motor cortex, there you go. That's just essential. All right. The other thing is, Freud was wrong. Brain envy is good. Freud, of course, has that, his first favorite organ is not the brain. I'm going to say that because that's kind of subtle, subtle, because we're all, gentlemen and ladies and so on. So, if you can come back from a traumatic brain injury, and this is what it is, because you may not know that, but the thing about traumatic brain injury, it has every element of every damn dementia you could possibly think about. It is a really complicated disease. It's really hard to come back from, okay? So, it's an injury to the head from a blunt or penetrating object, or injury from a rapid movement of the head that causes back and forth movements inside the skull. So basically, I got involved in a car that rolled down a hill, so my brain just was bleeding into a small area, and of course that crushes other tissue. So I lost, I don't know how much, but a lot of brain tissue, right? And this is a nice politically correct disease, because I didn't do anything wrong, it wasn't my fault, and suddenly I go from being a doctor to being somebody whose IQ dropped about 60 points, which is not good, right? So, cognitive impairment, which I'm sure you're aware of, is just like, so my symptoms mimic these symptoms, okay? Difficulty with cognitive process of everyday life. You can't read that, let me read it to you then, okay? A widespread range of functioning can occur as a result of Alzheimer's, dementia, stroke, traumatic brain injury. In this crowd, please watch your vascular stuff. High blood pressure and strokes, not good. That's where you're gonna, when I look at this crowd, I'm thinking, watch your blood pressure, okay? I just want to, let me just tell you a little bit what the brain is. It's jello and it's fat, okay? We'll talk about that later. Here's some more stuff about TBIs, but what happens in a TBI? You twist the nerves, right? Like the white pathways to different areas, they get twisted. And so the gray area for my Spanish section was still intact, but the road leading up there was twisted and gone. So incidentally, when that was fixed, then I could suddenly speak Spanish, because the gray area was there, but some of the long axons were gone. Nerve fibers are broken or stretched, temporary or permanent brain damage. I had some very bad problems. Mechanism of brain damage, I just thought, it's basically a hammer to the head. Thinking changes, so this is going to be our definition for bad mental health, okay? This is pretty easy. You know people that have done this. They can't concentrate, reduce visual attention, inability to divide attention between competing tasks. Does this sound like anybody you know? Is that, well, okay, put it back. Slow reading, slow thinking, slow verbal and written responses. So the easiest way I could say this, and my neurologist should have come up with this, but basically I figured out how to score TBIs. They just simply tell you how old you are. So I was thinking 42 or something when this happened. No, I was 48. And my doctor should have said, hey, Herlihy, it's real simple. You're 5. Learn to put your clothes on. Learn to take paper and scissors and everything you did when you were in kindergarten, and then progress to first grade, second grade, third grade, and fourth grade. Because I had to relearn the language, walk properly, there are a number of things, but it just progresses like that. So let me tell you, the good things that happened to me, let me just take you through my journal, the good things that happened and the things I'm not real happy with, okay? Because it is kind of, it's kind of an amazing journey. So I got scalped from the glass. It Parkland did a great job. Put that all A+ for surgeons. They're great. They put my head back. They really did a nice job on the internal derangement of my right knee. That thing was shredded, and they did a fantastic job. I could walk on it. I had some pelvic fractures. They did a good job with that. I had bilateral hernia. I had a bunch of broken ribs here that didn't really deal with, but for the most part, medicine is for, if this is really sick, if this is really healthy, they're good here. 75%, right? They're great here, right? The physical therapy I thought was horrible at Parkland. They did give me some narcotics and muscle relaxers, but the physical therapist was the physical therapy was embarrassing. Physical therapy in this country doesn't seem to do a damn bit of good. And I told the lady, hey lady, you're working me and this guy at the same time, and you're not even trying to hide the fact that you're working at two people at the same time. I think that's called double billing. I said, oh, be careful, your license, you're young, you don't know you could lose it. So 2 years later, 23%, 23 little doctor faces show up in the front cover of Dallas Morning News. They're all being fired. Big scandal, okay? Me, double billing, I told you, okay? Medicare, Humana Medicare still can't be, I can't use my Humana Medicare still department because of that scandal. So, your doctor isn't a god or goddess, not your father, not your mother, okay? Please, remember. They're prone to, what can I say? Okay, so, all right, here's the problem with the TBI, okay? I was obviously gorked, okay? I was 5 years old, and no one dealt with it to about a year later, right? Bad on traditional medicine, didn't get it, okay? So once they did get it, they kind of said, okay, and let's do the traditional thing, which is load you up on mood stabilizers, which are anti-seizure medications, which is great because I was yelling at cops. I mean, look, if you lose your frontal cortex, you're just not with it, and you can't make judgments, right? So let me put it this way. The human part of my brain was completely gone. That was worn down. So I basically I'm an animal. I have raw instincts, I'm impulsive, I yell at cops, I just do things that are just insane, right? So someone would not make my coffee right, not get angry at them. So mood stabilization was really important. A+ for that. Antidepressants, absolutely. Of course you're depressed because I'm in pain and I can't think anymore, right? So how much could I not think, by the way? So if you asked me for my address, I'd have to get my identification out. My memory was 3 minutes long, which is difficult to do when you're ordering something at Starbucks. Oh, I'm sorry. Okay. I told you. All right, now here's where you all got to be careful because, of course, I couldn't sleep. Of course, I had PTSD. Of course, I continued to think about the accident. So I was giving sleepers, which were helpful acutely. Okay. Later on, I discover that I didn't have any REM sleep, and that was making me crazy. So I know there's some people with some benzodiazepines here. Okay. I know people are taking sleepers here. Just remember, they're absolutely linked to dementia and cognitive impairment. Okay? We'll talk about that in a minute. All right. So, any questions so far? If you don't have a social, okay, go ahead.
What's the TBI?
Oh,
Traumatic brain injury.
Oh, thank you.
thank you for remembering.
Traumatic brain injury is
Oh,
the answer for the tape.
Yeah, and traumatic brain injury. Okay, John had one of these, and he knows exactly what it went through. Okay.
I have a question. When you had this accident, were you wearing a seatbelt or whatever?
Yeah. Well, yes, but I was more rolling down a hill,
Yeah.
right? So it wasn't a put your head through the windshield, okay? And just to address that, I see TBI, there's a whole lot of people who've had accidents, they don't think they have TBI, but they're heading the windshield. Of course they have a traumatic brain injury, right? Which is another failure of traditional medicine. And they're gonna kick my butt for this, but doctors, for God's sake, read the literature. I mean, what's the matter with you? You learn things in med school and you don't seem to change. There's a cutting edge, you gotta keep up. It gets me angry. Okay, so if you don't, the other thing is they really didn't catch these impairments till way late, okay? And as you know, anybody with a major problem is going to be what? Going to be blank by their family, friends, and loved ones. Going to be I thought you were going to say held close and loved, abandoned. Absolutely. This I cannot believe how many people have been abandoned because they didn't get correct care. So that's it. I had vocational school. I had vocational failure because my doctor said, "I'm sorry, you can't go down this corridor without hitting both sides of the wall, and you don't know you hit both sides of the wall. Family, life, social relationships collapse, increased financial burden on families and social services. Of course, it can't work. Alcohol and drug abuse, well, I just took, you might want to call some of the drug abuse normal prescriptions that I had to take by a doctor. It's kind of a, well, this is, you know, this is sort of a, okay, in chronic depression, anxiety, okay, so what happened? Can you read that up there?
Yes.
I got a man in, no social net marks. Where did I end up?
Homeless.
At the bridge. Yes, I was homeless for about 3 years. So, and I'm a doctor. I used to have a house on a golf course. So, Metro Street, if you ever get a chance to give MetroCare a street, MetroCare does the street work, and they do a pretty good job. Okay, so I'll give that traditional medicine a good marks, okay? But they don't give pain meds, and they basically treat most people as schizophrenics, right? So all those, so on the street, a lot of people are either vets, 30% with PTSD and head injuries, like I was, or schizophrenics, right? So they do a good job there. Traditional medicine, good, but no pain control, right? So if I roll in a car down a hill, am I going to have pain and 8 surgeries? Of course. And pain alone will make you crazy, okay? That's another factor making me more crazy, right? All right, so, and for those people who know other people with Alzheimer's or you know, anything but the shoulders, these apply to you, okay? So, I was super lucky, okay? Because I'm a doctor, and someone called in a favor for me because I was too crazy to do it myself. And I did see a forensic psychologist. So you want a forensic psychologist, psychiatrist, and they measure how crazy you are. And then they go tell the courts how crazy you are. And I was 92% disabled, physically and mentally, which is 8% normal. That's not much. But it was a real eye-opener. Because I didn't, so when you're just, the wonderful thing about being demented is you don't know that you're not right. And that's a blessing, right? And when I realized, oh my God, look at these tests, I am really whacked, that was a real eye-opening thing. But the nice thing about it is they give you disability. So you get a small paycheck, but you get insurance. Wow, good. Now I can go from the public sector to the private sector. All right, so that's really good. So A+ for that guy, okay? So far in the right direction. So if someone says, a forensic psychiatrist, and he's crying while he says this, and I'm so banged up, I feel like, that's funny, he's crying. I don't even get it, but hey, you're 92% disabled, and you're probably going to go into Alzheimer's in 2 years considering your genetic constitution and your dad. What would you do? And you knew what it was like. Right? And why did you know it was like? Because I diagnosed my dad. I was the one who diagnosed my dad with dementia. What would you do?
Commit suicide.
Of course you would, right? Well, traditional medicine does not get money points on this, okay? Because what do you think they want to do? Well, so, you know, I told my doctor, hey, like a good patient, hey, you know, I got a plan and I got a pay. That's all you need to say to get locked up. So he says, okay, you're going upstairs, and we're going to lock you up. Or sign this suicide contract. I'll give them a couple points for that. You sign the suicide contract. You're going to call them before you kill yourself. Okay? All right. So this is what I mean about a good doctor. Okay? Well, first of all, I was very impressed. Oh, well, I will tell you what I consider the forensic psychologist. That's a good doctor. You know why? Because after what he said sunk into me, I started to walk. Because I was like so shocked. And I started to walk around his couch, and I wasn't getting it. And he tackled me and sat on me and made me listen to him. And, you know, doctors just hate to get grubby with, you know, patients and stuff. They need to throw them around. That's a good doctor. He's stepping out his role. Okay, and the doctor at Parkland, this was great. This is what I want to see in doctors. He said, hey, he was the medical student. The damn doctor. It was the medical student say, hey, I've been to Iraq, because the 4th year. I've been to Iraq, I have a roadside bomb, and I want to commit suicide. You need a service dog. And that's the only reason it didn't come myself. So they don't usually do that, but every time I get a chance, I say, Doc, hey, service dog saved my life, here's the book, right? And just let me put in a plug for service dogs. Oh, they do just everything that you need to stay alive. They social, well, I couldn't talk. So I'd walk the dog, and people would talk to the dog, and I'd memorize what they say, and then I'd learn the language. And was I socialized? No, I looked like I was incredibly homeless, and I couldn't shower, and you know, I was just all over the place. It's not the person you want to talk to. That's why you get the cute small dog, right? Because they approach you, and eventually, enough people approach you, you go, oh, that's how you dress, and that's how you socialize, right? That's in Chewy, A Doctor's Tale. Oh, and by the way, and I'll go over this again, all the stuff I'm saying is on Brainblown.org. I'll give you a card or something. That's I don't want to get you too much information, but Brainblown.org. So here's one of my, you can't see this. This is a tie with 13 knots. This is basically, I was thinking about hanging myself. So I did a little, I'll never forget that. Let's see what else we got. Oh, okay, service dogs. So can you see this? You can see this, right? So get a service dog, because I would do things for my dog that I would never do for myself, right? I'll turn the air conditioner on in the car when I can't afford it because my dog's uncomfortable, right? So please, get a service dog for your friends. What do you need for a service dog?
Doctor's prescription?
Thank you. No registration, nothing like that. At our age, if you want to travel on the airlines, my patient Joe needs a service dog for ambulation or something. That's all you need. Stick the little collar thing on them and just go, all right? No one's going to screw with you anyway because you got silver hair, right? But that's all you need. But if you want to go on the airline, you got to have that, which is nice because I used to travel a lot and give people lectures, and I didn't have to pay for my dog. Does that make sense? So don't bother with registrations. Get somebody to get your friend. Let's say your friend has dementia. Oh, and by the way, my service dog did a great job with had a patient, she had Alzheimer's, and we gave her the dog for a couple of days and monitored her behavior, and it was really incredible because she would stay with the dog and not wander off, because they wander, right? Okay, so here's not a bad thing. So psychologists aren't bad, they're generally out-of-the-box thinkers. So the TBI specialist I had showed me by film and everything else, you're really whacked. You dress this way, you talk this way, and that's kind of what they do. They kind of build you up from the bottom up. They give you the basic skills of dressing and interactions, and they tell you when to eat, things like that. It's not bad. As I said, Medicare made private doctors available. That was A+. Okay, I know a lot of disabled, and if they're just on Medicaid, it's just not good. They're very unhappy with it. Okay, pain psychiatrist. Ooh, this is really important now. I don't know how many people have pain, but let me tell you, it'll drive you crazy, right? That's the reason most people kill themselves from the pain, okay? But it was great to have a guy who said, okay, yeah, you need opioids, and let's tweak your antidepressants, let's tweak your anti-seizure medications. And that's all I did. He also said, oh yeah, we need a little bit better form of sleepers, and you need some speed, you need some alcohol, which is great because yes, you're taking narcotics and speed at the same time, but it's absolutely necessary because you're so whacked out, you can't even concentrate enough to learn the language, right? So I got rid of my pain, and then I can relax, and then I have enough ability to concentrate from the Adderall. And kids use that all the time. Oh, by the way, just a word, and we'll come to this later. Psych drugs are very difficult to titrate. It took me 3 years to find the right combination. 3 years, okay? Just a word of warning, psych meds take a long time to figure out. And still, I don't like some side effects of my medication, but, we'll talk about that later. Just as a word of warning. Okay, so that's kind of traditional medicine. So, what can I say? What really helped? So I got to a point where I needed to go outside the system. And this happens to everybody. Hey, sorry, we can't help you. I don't know what to do. I don't know, okay? So osteopathic manipulative medicine, has anybody ever heard of that?
Mhm.
Okay, well, I went to an osteopathic school in Fort Worth, and it's hands-on medicine. It's what doctors did before they discovered CTs and they didn't have to touch people, it just order a very expensive test and have somebody else pay for it instead of touching people. Okay, osteopathic manipulative medicine is physicians touching patients from head to toe, and they can tell a hell of a lot about you, right? It's a really good these are great diagnostic tools, and not a lot of people do it anymore. I do it. So I did have a patient who was a traumatic brain injury, because that's kind of what I was doing. I was doing this kind of physical therapy, and this is how accurate, this is how good you can get with your hands if you're finding one of those guys. I told her that her parietal bone was stuck, and it wasn't an external force, because she nearly drowned with a near drowning experience in Hawaii, hit her head on the bottom of the ocean. We thought that was it. I said, this isn't moving. I said, the only thing that pulls a bone from the inside is only one thing. Can you guess?
Cancer.
Yeah. So I said, you need an MRI. Sure enough, I hate being right sometimes. But yes, osteopathic, if you can find a full-time osteopath, yeah, she did have cancer. And I was happy about it, but unhappy. But, I saved her a couple years, right? And we'll talk about that in a minute, okay? Believe it or not, here's something, even at any age, that you might find astounding. So I'm running around with like a 75, 85 IQ. Okay, so 100's normal. I used to have 145, which is genius, and now I'm really slow. In the old days, they would say retarded. Now we say cognitive impaired, but really slow, okay? My osteopathic doctor, because osteopathic physicians, like my training, they think globally. They do family practice, they think globally, and they're more likely to think outside the box, right? He says, have you got your testosterone checked? I said, no. And we checked my testosterone, and there wasn't any. Because you hit this, the hypothalamic, thalamic, pituitary axis is gone. No kidding. 3 days after putting gel on my self-testosterone, 3 days, IQ improved probably 30 points. It was a day I'll always remember. And why do I want to tell you that? Because he was thinking out of the box, and doctors who think out of the box, I have to tell you, most doctors are not thinking out of the box, so you may have to pay, you have to go to someone special, but bioidentical hormones are very helpful. So for men, that may be testosterone plus a estrogen blocker and some other things. And for women, they used to say, oh, here's your estrogen for your menopause, but now they say, oh, here's your estrogen, your progesterone, your estradiol. Okay, it's much more sophisticated, and even people who can't afford this find the money somehow, because it does make people feel much younger. So the 50 people are getting it, and they're feeling 30, and if they don't have the money, I would bioidentical hormones. The doctors who do that are thinking out of the box, right? And it just must want you. It might be $100 a month, but people seem to love it. The next one says RX sleepers. So one of the things I was getting worse with my dementia. Worse, not better, right? Everybody's supposed to get better. I was getting worse. So it turns out that the sleepers that everybody here is taking, the Ambien and the Halcyon, whatever they take, but it's basically kind of like anesthesia, right? And you can't remember that you had surgery, and that's important. They give you that kind of energy, so you don't remember that it wasn't fun, right? But it also takes away other things like REM sleep, and that's really important. So sleeping is super important, okay? And at the end of this, I'll tie everything together by saying, let's just do 3 things that you can remember, okay? And sleeping is definitely one of them, okay? Because in the first part of sleeping, you're bringing blood in and throwing out the trash. But the second part is even interesting, and I hate to say the royal road to the unconsciousness, the Freud thing of dreaming. Dreaming, in our understanding of it now, is when you decide that this memory doesn't need to be, we don't need to keep those neuronal pathways here, because this is not important, right? And that's important, so we'll keep this, but this isn't important. So that apparently is what dreaming does, right? And we literally cut neurons and say, no, we'll just save that for another day. So I'm going to tell you a little bit later what replaced by Ambien, right? But I would just be really careful, okay? Because, well, is there an opioid crisis? Let me just explain this. First of all, we overprescribe opium because it's, if you're seeing 7 patients in an hour, how are you going to do? You're going to talk to them? I'm not going to talk to them. You're going to give them Xanax. Oh, it's not here's Xanax, here's this, right? So opium cures everything, right? And now that we have a crisis, guess what? I can't prescribe any more opioids to you because the FDA says no. And now you're a drug addict, and I don't treat drug addicts. All right, let me explain this. I'm going to make John a drug addict by giving him opioids, okay? And then when they say don't give him anymore, I'm going to say, sorry, go someplace else, you're a drug addict. And I don't treat drug addicts. That's another body. Go over there to the addiction specialist. All right? This is a huge failure of medicine. How could you screw up so much? Right? It boggles the mind. Johnson & Johnson, 547 million, the first go round. Okay? Watch the lawsuits come in. Everybody is suing over that. It's just an obvious. It's just, boy, one pill for a million things, one molecule for a million things. No, multi-pronged approach to problems, especially the brain. It's a complicated organ. You need to do social, you need to do your food, exercise, but we'll go. Okay. All right, I love my cardiologist. Okay? He's very nice, very amicable. I'm sure he's bright, very sweet. He's in good shape, but I asked him purposely, so I could tell you, what do you think about diet? Mediterranean or paleo? What do you think he said?
Know nothing about it.
Something that shocked the hell out of me. He said, well, it's really not what you eat, it's the total caloric intake. There is so much literature about diet out there. It's overwhelming. What the hell went wrong? Is that his little speech so he can get the hell out of the room? Please tell me. I was absolutely astonished. What is that, 20 years ago? He didn't even say the Mediterranean diet. Okay, so here's something you don't know. Let me give you a few hints on diet, okay? So, yes, microbiology, 2.5 years, graduate school. I was doing microbiology when HIV was around. Very interesting time to study viruses and bacteria and parasites. So, guess what? This is very, very, very cool stuff. Your doctors are not thinking about this. Okay, so diet. So we have actually found, the literature's only a month old, 2 bacteria that if you have these in your stomach and your colon, you will reduce Alzheimer's symptoms. That to me is absolutely, I love to say this, mind-blowing, right? It's absolutely astonishing. So the whole idea is when you feed you feed your bacteria, okay? And your bacteria count. They're your little people inside of you, and they make poisons and they make good things, and if you have the wrong kind, you're in really big trouble, right? But if you have these 2, and you have to go to the website because they're really long words and it's 14 letters each. Cocciotus or something. Okay, but if you can go to the health food store and buy the typical stuff, which is bifido and lactobacillus, that'll at least stop leaking gut syndrome. So that's not a bad idea, but they're moving into treating diabetes by what? Changing the bacteria in your colon, right? So in our colon we have 2.5 pounds of bacteria. It's super important what kind you have. So that's where we're getting with diet. We want you to feed the bacteria in your stomach. That's a remarkable jump. That is not total dietary caloric intake. Take these probiotics to feed specifically these bacteria in your colon. You may not like the taste, but the bacteria will. That's amazing. Okay, so, all right, I I just put here the modified, look, if you can't figure it out, it's easy, just the Mediterranean diet. Okay, so not, well, Medina, Roma, restaurant. So Mediterranean diet is a good idea. Okay, so that means fish and not a lot of pasta and not a lot of animal fat, some meats, right? But, you know, I lived in Rome and you'd have an orange for dessert and salad, right? So Mediterranean diet is what people are going for. This is really interesting. So let me tell you about Parkland. Now, I will give her credit. So Tricia, they had a nutritionalist, and she said, hey, by the way, you have a TBI, it could be connected to inflammation. Wow, what a revelation. And she said, why don't you start eliminating things that make you, Irish people, inflamed? At the time, I had bright inflaming red hair, which would be milk, gluten, a couple other things, and sure enough, I lost 3 inches on my waist and started to feel less brain fog. I says, that's why I don't have more jokes. I was really expecting them to become spontaneous to me. It's just not working. Maybe it's brain fog. I don't know. But I will say for a hospital nutritionist, that was pretty bright thinking. But don't forget the word inflammation, okay? Turns out, I asked my sister, she doesn't have gluten intolerance. She has full-blown celiac disease, and she went to the hospital for it, and it nearly killed her. Eating wheat nearly killed her. Put her in the hospital, took them 7.5 years to figure it out. And she's a nurse. Yowza. So, Darty's, anybody know Darty's Pharmacy? The oldest pharmacy in Dallas? Okay, they're pretty good. I'm going to send you down there because there's a registered dietitian, and she's Indian, and they pretty much know what's going on. So for supplements and anti-inflammation stuff, she was pretty good. So she talked about fish oils being good for inflammation, and DHA and EPO, some certain kind of fats. The brain's made of jello, so certain kind of fats really help. Okay, and you got to take those. Let's see. Oh, by the way, there's a new NIH study on processed food. Never been one before. Guess what the conclusion is? Processed food isn't good for you. Well, that's a surprise, right? So then I went to a pharmacist who was a nutritionist, and then he gave me some, this is going to make sense. He said no sugar. And I've come to realize that sugar should be a controlled substance. It's as dangerous as opium. No sugar. I know that's going to kill you. I know that's going to kill you. But I use stevia, and my sugar count is very low. And that'll come in handy in just a minute, because I'll explain why that's important. Okay? Let's move on down. Okay, so the brain, by the way, the Center for Brain Health in Dallas is a great resource. I did 1.5 years over there. I was a research student, and they tried to train me, because I was still brain injured, from the top down. They have a SMART program where they try to teach people to think. It was very effective. And now they use that same program that I was in. They got 8 white papers, which is very important, and they now teach cops how to think. Instead of shooting people, you might want to think about it. And they teach executives how to think, and children how to think, right? So that works. But if you get a chance to go to, there's lots of lectures down there, especially on Friday, and they're brilliant people. These are the best people in the brain field. So the Center for Brain Health is connected with UT Dallas and Southwestern, and they're some of the smartest people going. They're really very impressed. I can't believe I'm in the room with them. Okay, so now let's get into some strange things. So I went to an A4 conference in Las Vegas. That means the American Academy of Anti-Aging Medicine. So did you know there's actually something called anti-aging medicine? I did not. And when I walked into this place, I said, holy polio. I saw 100 machines I've never seen before. Saw another couple hundred of nutritional stuff I had no clue. As a traditional doctor, I said, holy polio, where the hell is this coming from? Okay? 100 different things. 100 different things. My conclusion at the end of that was doctors are about 17 years behind the current information. So, oh yeah, absolutely. And there's reasons for that, but I won't go into that. But let me tell you what I picked up from this. Neurofeedback. I had 100 sessions. People usually need 20. Neurofeedback was very helpful. In fact, let me just say electricity in the brain is going to be very powerful in the next couple of years. Neurofeedback measures your EEGs and says, I was walking around, here's the big thing, in basically sleep mode, and so they train you to come out of that, okay, with lights and sound. But here's the thing, the reason I was getting worse was my EEG showed me I had chronic neurological inflammation. That's why I was getting worse. And lucky for me, I pulled the doctor card. It was read by one of the big, one of the guys who, top 3 in the country. Inflammation. Big, big, big thing. What else did I see? Let's see. Infrared light. This was amazing. So they're putting infrared lights on people, and it tends to break up the tau and protein and the amyloid neurofibrillary tangles of Alzheimer's. Weird, huh? Weird. But it seems to work. Infrared light, it really helps wound healing. So if you're diabetic, you want infrared light. Your doctors won't prescribe that. They won't even know about it. Okay, so I saw the studies on this. I met the guy who invented it. I was pretty impressed. Let's see. Pulse electronic magnetic therapy. Wow. They pulse. Okay, so you know what an MRI is? It pulses. Okay. Well, they're smaller machines that can do that, and I was very impressed. So I don't have sight. Oh, there you go. I don't have any nerves here. So my gluteus medius slumps, which puts pressures on all these other nerves, and so I'm in pain, right? So for 2 weeks I did pulse electronic magnetic therapy and brought the nerve back to life. And once it came back, then the nerve worked, and my gluteus medius, for instance, would work, and I would hip hike myself back and not crush my nerves. And that was amazing to me, right? The same machine also, I did it with a professional, and I got rid of my pain for 6 weeks. I couldn't believe it. It was the weirdest thing, right? Electricity again. I had big magnets on my head, and that seemed to bring a lot of things back from my mind. That's not just, by the way, thank God, that's now practiced by traditional doctors. But this was years ago, okay? So they're slowly coming around, okay? So, let's see. There is a list that I keep, and you have to go to Brainblown.org. So when you go to these conferences, these are the guys. There's a psychiatrist, all he does is Alzheimer's, and he says, hey, here's the 10 things we're going to talk about. They are supplements, because you hear supplements and vitamins, and who the hell knows, But he says, here's the 10 ones I recommend, and then for each hour, for each supplement, he gave an hour lecture, which was like very impressive, because it was like medical school, and he said, magnesium does this and this and this, and about 65 things, and afterwards you understand why magnesium is absolutely important for brain function. So is zinc, so is lithium, so is all the B vitamins, and they work in concert, and then you have to have certain fats, okay? That list is there, and I take those every day. It's not that expensive. But yes, these are specific supplements for the brain. Oh, by the way, and this is all kind of correlated with lots of research. Here's a really fun thing, nootropics. Nootropic, Nootropic. That's something fun to Google. So a guy started a brand called Bulletproof Coffee. Look him up. This guy has been trying, okay, I guess when he was a kid he did some LSD and said, wow, this really makes me think. So he spent most of his life trying to figure out how to think better, right? So that's called nootropics, and he came up with a bunch of them, right? Which you may know Adderall. But there's a whole bunch out there that are non-prescription. But by the way, Provigil is something I take, by the way, instead of Adderall, which is a great medication. I'll just tell you something about it. COPS and airline pilots can take it. So it's kind of like speed, but it doesn't have any side effects, and you know it doesn't, because if you give speed to a cop, he's likely to shoot not one person, but probably 3 a shift, so you wouldn't want to do that. Okay. Does that make sense? So Provigil is a good nootropic, but what I do every morning, because of this guy, and I met him at one of these conferences, he puts butter, he has coffee that's not this mold-free, because people are losing it, and then he puts butter and coconut oil in. That was clever, so why did he do that? Because the butter makes butyric acid, which is really good, it grows the right, you're feeding your bacteria, okay? And the coconut oil are medium chain triglycerides, which are one of the few foods the brain eats. The brain eats sugar and medium chain triglycerides. So that kind of gives you a burst of energy. Okay, so nootropics deals with this idea how to think better. And I got the idea of taking 200 milligrams of caffeine and theanine, which is an amino acid, putting them together and eating them if I don't have time for coffee. And it gives me a jolt, but it also calms me down at the same time. So there's a lot of really clever things. You're going to have to look it up yourself, okay? Okay, it's going to make you happy. So my nephew was on Notre Dame football team, and he was taking, what was he taking? They're saying nitric oxides. So if you take the nitric, you know, when you do your powders for like your, I do a lot of powder, like protein powder, because it's easier for me to digest, and if I'm working really hard doing physical therapy, which I do. Okay, but the nitric supplements are good too because it vasodilates you, which gets more blood to your brain and to your muscles, right? So those are good, but here's good news too. What else gets brain to your blood? But what else gets blood to your brain?
Being upside down.
It does. But there's something else that gets brought to you by that. This just kills me, okay? So my brother is a pulmonologist, and if the right side of your heart isn't working, then everything backs up into your lungs. So that's called pulmonary hypertension. And the drug invented to fix that, so high blood pressure in the lungs, was Cialis, right? So Cialis actually, do we know what Cialis is? What? Niagara and vigorous means Viagra, right? That's how they named it. Cialis is the long-term version. Take it Friday, you're still happy on Monday, right? So that's the best news I ever heard. I can just take this all the time, right? And get blood in my brain and walk around with an erection. So it's just fantastic, you know. So. Oh, we'll talk about sugar, by the way. Here's something really cool that direct cranial electricity from a 9-volt battery gives you about an hour and a half of you'll be really bright for an hour and a half. And they're studying that at the Center for Brain Health, right? Oh, by the way, this has been like A4M I talked about, they've been doing that for years. But now they're officially, like the NIH is saying, maybe there's something here. And when I went down and talked to the brain health people, he was more than happy to tell me, but it gives you about an hour and a half, so if you're taking a test or something, if you have to be really sharp for an hour and a half, put some current across your brain. I just thought that was really fascinating. So magnets across your brain, and pulse electronic magnets, and direct current, and AC too, all right? So we're really getting into stimulating the brain with electricity. Pain, I have a lot of pain. And the VA, I went down to the VA and they certified me in something called, this is really cool, battlefield auricular acupuncture. So they just call it battlefield acupuncture. So there's 5 spots on the ear that you can put little pins in. And if you're in a fighting situation, you can still fight without the fog of taking narcotics, right? So you can get shot or you can have a sprain or whatever. And I thought that was great for people with chronic pain. You don't even have a license. You just get the little pins and put them in, okay? That's thinking out of the box, right? Anybody have any questions here? We're getting a little tired here. Questions? Anybody need some Dotron? I have some Adderall. I have some Provigil. We can split it. Use the straws. Snort it up your nose. We can do this. You don't need just cap. Yes, a question there? Question?
Well, we're talking about Cialis.
Yeah.
Where's the mic?
and I don't think that, I mean, there's a lot against taking Cialis as well from the heart perspective. So I don't-
Well, the interesting thing about Cialis is, okay, I know a lot of people with blood pressure, and, oh, there you go. And in fact, I can't even say, a very important person, a doctor that I know that's very important, he has blood pressure not controlled on 2 of them, and that he takes Cialis, and that brings it down to normal levels. So that's what I know about it is, and just the whole point is, get blood to the brain, and then get it drained away. Perfusion of the brain is super important to bring in sugars, nutrients, pieces of whatever they need, right? And then take the trash away.
Yeah, but what about the male's other brain that gets too much blood to it, and after 4 hours, it's recommended that they go to the emergency room? So,
Name one.
sorry?
Name one.
No, I'm just saying, you know, having a perpetual erection, you know, beyond its norm is not so good.
I've never experienced that, nor have I heard that in anybody else.
Well,
It used to that used to happen when you inject your penis with this medicine, but that's all gone now. I don't think Cialis works. It doesn't seem Cialis works that way. In fact, I take Cialis and without sexual stimulation, I don't get an erection. It's the weirdest thing.
you have to get turned on to make it truly
Right.
effective, I'm sure. But what I'm trying to say is that it is one of the cautions that they indicate.
Oh, right. Well, yes.
Well, I understand that they can also give a plethora of cautions just to cover their angle, but I'm just saying.
Exactly.
You know, aren't there other blood pressure medications that will have the same
Not that I know.
effect?
Not that I know. I mean, you take blood pressure to reduce your blood pressure. Too much hypertension, you're really not going to get any blood flow. And I just mentioned it because I thought it was a fun fact.
Okay.
And it's all about blood perfusion. Now, we're going to talk about herbs next, as a matter of fact. So what I would recommend is they don't really have something to increase blood pressure or blood to the brain, okay? So that's where I'm going to say go with herbs. So go to a little, you know, a natural food store, find the oldest hippie there, and then ask that person what they recommend. Because they've been around long enough to know that this is an industry that is totally unregulated, and stuff comes in from China, and that's not good. So you want a U.S. organic company that doesn't ship thing in, because every time herbs get shipped in, what happens? They get irradiated, right?
Oh, yeah.
So that's a problem. So there's not a lot of, there's maybe 5 or 6 companies I recommend, but ginkgo biloba is known to increase perfusion.
What about niacin?
Yeah, niacin, yes, niacin will work, but you need the extended release. Niacin tends to peripherally vasodilate you, but if you get the extended release, yes.
Actually, Nature Sunshine out of, what is it, Utah, is a great herbal company.
I use, so I'm on these antidepressants, and what I found is that I could use herbs. So I use ashwagandha, which is a concept totally unfamiliar to Americans in Western medicine. It's an adaptogen. So if your blood pressure is too high, it comes down. If it's too low, it goes up. And that's a concept totally unfamiliar to us. And I use St. John's worts. I use holy basil, and it does help. It is replacing I'm slowly getting off my antidepressant, and there's no side effects. By the way, I'm taking Cialis for what? For a side effect of my antidepressant. And I think almost all antidepressants decrease your libido. Right? And they knock it out here in your limbic system, and you can't even, I can't even, when I'm on my antidepressants in full strength, I'm 8 years old. I think kissing is gross. I just can't even imagine sex. It just doesn't occur to me. Because the limbic system has been knocked out. So, and I meet a lot of people who will absolutely not take a pill, but they'll take herbs. And, you know, a lot of our medications came from herbs, right? Did you tell us?
Oh, yeah.
All right, we're almost finished. If you're a vet, iRest down at the Center for Brain Health is a PTSD. It's a yoga PTSD meditation combination. iRest. So go to the Center for Brain Health. That's very helpful for people who are suffering from TBIs and PTSD, and certainly open for vets. It's a nonprofit organization. Another avenue that will be coming up and help me is virtual reality. So you put those goggles on. Center for Brain Health does this. In fact, next Friday I think there's going to be a Center for Brain Health lecture. Put these goggles on and they take you to a different reality. So, with my brain injury, it's really, really strange with a brain injury. You could do some really complicated things, but you can't do simple things. And it's like this. If you just try to remember what happened yesterday, you can call that out to your brain, but nothing comes back. It's as if yesterday didn't exist. What did I eat for breakfast this morning? Nothing comes back. Nothing. It's just amazing. So I couldn't go to the self-checkout in the stores. It just overwhelmed me. There's something wrong with my brain that I couldn't add numbers and couldn't figure out the slot where it goes in and what to do. It has nothing to do with intelligence. It has with gray matter not being present. Okay. So what they're doing is walking people like me through a store. And you get to put your goggles on, and somebody will tell you what to do. And there's usually two psychologists saying, do this, don't do that, how are you feeling? So there's going to be a lot of artificial intelligence for a million different things. Okay, almost finished. Then yoga, 95% decrease in pain. Great stuff. Yoga and osteopathic manipulation are the same thing. Yoga for pain. Anybody with pain, try yoga. And go to a therapist go to an older therapist who's been hurt, who doesn't want to look good, her objective is not to look good in tight clothes and to stretch like you can't believe, okay? You have to go to a therapeutic yoga instructor, right? That's not a 20-year-old, by the way. Let me just finish with two things. There's something called a vagus stimulator.
What is that?
Something French. Vagus stimulator, something French. Vagus stimulator stimulates the vagus nerve, which comes here, goes down to your diaphragm, comes up back here, and goes to your gut. When you stimulate it, it gives you parasympathetic relaxation effect. Okay, that's good because your brain needs that. If you're constantly wired, your brain is not going to function well. Okay, that's on the horizon. Some people are doing it. Oh, and for other people, this is brand new information. It's only a couple days old. There is a new technique they're doing to regrow the thymus. So the thymus is right here, right? And it's really big when you're 12, and it modulates your immune system. And they're regrowing it, but they're also giving you DHEA and metformin. So let's parse that out. And they're actually seeing not people stabilizing the age, people are getting younger. How do they prove that? Methylation of DHEA. So people are getting younger. I've never seen that before, all right? So how does this make sense? Let's try to make sense. All right, so let me make this really simple for you. If you have Alzheimer's, there's 3 types. There's inflammation, which I have. So you want to do everything to prevent inflammation. There's sugar. So there's Alzheimer's is kind of like diabetes, okay? So what sugar does is it gums up the works, tags itself to small vessels. It gums up the head and makes the brain fire randomly. So sugar is incredibly poisonous, and it's everywhere. So I don't smoke pot or do drugs anymore. I eat carbohydrates where I feel like being bad, right? And the other thing is about Alzheimer's, there's another type that's really complicated, but it's basically poisons, okay? So let me explain, or infections. So let me explain. So Michelle, who I detected brain injury, brain cancer, she has a glioma. And now they think glioma is the herpes virus that hides in nerves, and if you get really stressed, what happens? Does anybody notice when you get really stressed, you get a herpes blister?
Yes.
Okay, so when you get really stressed, your immune system is not working, okay? So the little white blood cells that run around detecting cancer and herpes and stuff, they're gone, so everybody comes out to play, right? And this herpes virus is in the brain cells, and it causes cancer. So let's do it again. Please avoid sugar if you don't want to get Alzheimer's and brain fog. And inflammation, and we'll talk about that in a minute. And watch your stress, okay? Because when you get really stressed, I guarantee you your immune system isn't working. And I consistently say to people, your wife just died of colon cancer and you are wiping her butt at the very end. You're going to get cancer in a year. Mark my words, some bad thing will happen to you in 1 year because your immune system is gone and bad things will happen. Okay. Inflammation, by the way, is also, I mean, what's a heart attack? A heart attack is inflammation. So let's add another thing. Heart health is very, the brain is as healthy as the heart. Okay, because of the perfusion issue. Watch your sugars, watch your inflammation. And watch your stress because it causes the immune system to misfire. Yes. So, we're going to open up to questions except for when I was homeless, double hand. When I was double hand. When I was homeless, I was hanging out with a guy named Zen who was like on the street, like famous for his Buddhist-like quotes. And he said something so profound, I must share it. If you're homeless, Zen said, "Hey doc, you got to know this about being homeless." "Oh, Zen, what is it?" You know, pregnant pause, grabbed it. He said, "Never wear white when you're homeless." Is that profound? That's profound. I like this woman here. She lives. This is a book that's coming out. You can reference that for what it's like to lose your brain. Brainblown.org. I have all this information if you want the list. MD Edge, if you want to get. MD Edge gives you the latest stuff on what's happening in medicine. It's a podcast. It's brilliant. I mean, the stuff about the things I quoted you, they're super brand new. They got that. Dr. Amen is very interesting when it comes to brain stuff. And Brett Denson, this guy here, Brett Denson, I met him, and he's actually able to reverse Alzheimer's. Through a what? A pill? No, not through a pill, because Big Pharma has lost so much money trying to find one pill to cure Alzheimer's, they've officially given up on it. Billions of dollars they spent, and they all say, we give up on this. Unfortunately, so what? What's it mean? You've got to have a multi-pronged approach to the disease, right? You got to hit the diet, the sugar, mental stimulation, socialization, all that stuff. Okay, does that make sense? So, before we ask and answer questions, my dog would like to hand out these very nice presents to the person who found all my neurological deficits. Does anybody want to?
Found and list them, you mean?
Yeah, shout it out.
Well, I had some questions on some deficits that you didn't mention, which do they all go away? Like you said that you would reverse it
Right.
back to like 5.
Not normal, no.
Well, but I'm
No.
just saying, like they said, begin that the damage, had started if you were 5. What I wanted to know was there, and then your family relationships and everything else fell apart after this trauma. A couple of things I wanted to know. One, was there any humor in your life at that time that people either tried to share with you, or that you were able to express yourself or even understand? Because, obviously, when one is looking, becomes caretakers, they try to start in with good cheer. It may end up reverting to something else and resentment at the end of the day. But I just wondered, what was your understanding of humor at that point? And were you receptive to it, or did you try to give? No, well, humor is a high functioning, if you can make a joke, your brain is functioning, right? My brain wasn't functioning. Also, humor, you gotta think, is a synergistic thing. I gotta think of the word, I gotta think of why it's funny, I gotta be witty, I gotta apply it to, okay? And then, right, so that was completely gone. But
I did have Sony Rao, one of my psychologists says, why don't you start writing things? You can't speak the language. Why don't you start writing? And so 7 years later, I wrote most days, and eventually I came up with, the Chewy book has been called Pithy and Funny. It's and this brain book, okay, so actually what I'm trying to say is I found my higher executive functionings by bibliotherapy, okay? So I'm glad you asked that. And bibliotherapy is really important because when your memory is 3 minutes long, right? So you have to constantly remind yourself where you at, and by looking at clues, like what are people doing? Oh, I'm at Starbucks. Where's the board? Oh, okay, there. It's okay. So when you do bibliotherapy, your tongue and your back here, you're visualizing, and you're trying to speak it to yourself. And here's a parietal area, Wernicke's, Broca's. So that helped the most, and it did, and it made me re-story my life. Well, there's two things. One, it's a hero story because you write so that you can improve yourself, and that's what heroes do. Number two, yes, my books turned out to be really funny, which is a classic Irish defense mechanism. And to be honest, the suicide sections of my new book are riotous. People are laughing through the whole thing, right? And it's suicide. So yes, I think humor is probably the best defense, but no, I couldn't make humor because I was a higher executive function. Only after I wrote for years and these things came back was I able to make a joke. So I don't know what the answer is, but Chewy Doctor's Tale is pretty funny.
Okay, and does the same response apply to common sense, empathy? I mean, common sense can be, intelligence in poor man's clothing, obviously. Okay, but did you have even the fundamentals of any kind of common sense or right from wrong?
Oh. I was 92% disabled physically and mentally. So when the psychologist comes in and is crying, well, I saw visually he was crying, but I had no damn reason why he was doing it. Okay? No idea. Okay? When my wife heard the diagnosis later on, she was crying, and I didn't understand why she was upset. No, I mean, I lost the upper cortex, which is what's making human, and after that, your monkey brain, and then your fish brain. Okay, so I lost all that. No, I didn't understand about. I didn't understand any of those concepts. No. And so if I can come back, maybe some other people can. If the things that help me come back, maybe they can help you. And let me tell you, I did get some nice treatment because I had some backers, and I'm a doctor, so I got a lot of nice treatment that wouldn't occur to you. It may not even be an option, but you can go after it if you want.
Yeah. Okay. Well, very good talk.
Well, thank you. That fellow down there wants to. He just
A very patient man.
Not always. I had only 10 things that I marked down here. First, have you heard of the experience? I remember reading about this. Mel Gibson took his father to Panama for stem cell treatment because he had a bad case of Alzheimer's, and he came back cracking jokes.
Stem cells will be very important, yes.
And,
But I don't think neurologically we're there yet. So they're great for your knee. There's still some debate. But neurologically, I don't think they're there yet. But yes, absolutely. Stem cells are pluripotential cells, so you put them in your knee, and they look around and say, oh, we have damaged meniscus here. I'll be a meniscus. I'll build some meniscus. Or if you put it into your brain, they're going to go, oh, there's gray matter damage here. I'll do that. Because the body is calling. This is why doctors, I distrust doctors, okay? Traditional doctors, because the body is the ultimate healer.
Amen.
You've got to listen to the body. There's a whole medicinal cabinet that we got inside. The body calls for these pluripotential cells to do something specific. But it's the inherent ability of the body to heal itself. And traditional medicine is a poor imitation of that. And it's not respected. I come out of the surgical screen and said, I cured this patient. You did not cure this patient. You aided the body enough so that it could help itself. Right? Anyway, does that... The stem cell thing will work. Mel Gibson's got enough money to make it work, so that's a few years off.
Well, in Panama, they're trying to make it available at reasonable prices to everybody. That's what
Fabulous.
it's saying in that. Now, secondly, I remember reading this story years ago, and apparently it's not just one of them. There was a man who grew up normally through high school and was on athletic teams and made average grades, and then later got married, and they had a 2-car garage house, and he had a job, and, you know, they had kids, normal family life. And then it came to a point at which he had to have a brain scan, and he had no brain other than a brain stem. And that's not an isolated case.
You're talking about my brother, who went to Harvard, by the way, and Georgetown undergraduate and Harvard graduate school for medicine. So you're probably talking about him, right?
Well, this was actually was medically proven.
Well, you know, I can't really speak to that, but
Well, I just thought you'd find that.
no, it is amusing. But quit talking about my family that way. Obviously, I'm having a few abandonment issues, as you might understand.
Now, you mentioned training cops to be more
Right.
considered and so forth. In Japan, the police are required to study flower arranging in order to generate more sensitivity.
Good stuff. Yeah, I love that out of the box thinking. That's especially, but wait, pair that with some science, okay? Don't just go, you know, if there's some research or even, okay, let me tell you something that, like, there's this research which is like white paper, so it's double-blind, placebo-controlled, reviewed by the peers. All right, that's great stuff, but that's usually really esoteric stuff. The clinical stuff is, like, I'm a family practice doctor, a person comes in and they have, their legs are moving at night. This is before they called it restless leg, and I gotta figure out how to fix it without hurting them too much. And I give them anti-malarials, and the older doc says, don't tell them it's anti-malarials, but it does work. So clinical stuff is a lot more practical. But if you connect some of these Yahoo crazy things with some studies, even if it's clinical studies, I like that, right? Because, you know, the herbal supplement industry is completely unregulated, and it would be, you know, what I do is I see what the Germans are doing, because they do prescribe all these things, right? So SAMI, they do for depression, SAMI, St. Wart's, St. John's, Holy Basil. It's on their formulary, so you're likely to get that. So the Germans are pretty smart in terms of this sort of thing, and it's scientifically studied.
Okay, one other just quick thing, instead of all 10. There's an excellent book called Blue Zones, and I recommend it to everybody because it studies certain particular areas in the world, like in Sicily and Ireland, Japan, and
The
Costa
5
Rica and so
areas with into the centenarians?
Yes, they lived well over 100, and there's a mountain village in Russia where people have lived over 150 years. And they interviewed, I saw this, they were translating it. They interviewed a man who was 120, and he had just married a woman who was 112. And they asked him, well, would you ever consider marrying a woman under 100? And he said, no, it'd be too hard to train. Great humor.
I don't think there's a McDonald's anywhere near this place.
Probably not.
Right.
Probably not.
No processed food.
I've heard various lectures I've gone to. Pineapple juice is very anti-aging. Some doctors said we should have it every single day. I kind of think mushrooms cure almost anything, don't they? But coconut oil has actually been studied and proven that it produces ketones in the brain.
Right.
Yeah,
Yeah,
3
that's what-
tablespoons a day, right?
Well, yeah, that's why I put in instead of sugar in my coffee, I put medium chain triglycerides, which the brain can feed off of, yes. In fact, it's actually in restaurants now. I mean, just tickled pink that, like, it's very hip. Have the same coffee at $5 a piece, but anyway.
I was going back to your time when you were homeless. Okay. What is your evaluation of the majority? Because you mentioned lots of people had automatically. Brain injuries with schizophrenic or what have you, okay, depressed, whatever. So what is your view of the homeless population, in general? Do you think they're there by choice? And that basically all they need to do, as some people believe, just pull themselves up and go get a bloody job, right? And life will be fine for them again, which I find hard, because I believe I heard you kind of say what I've always thought the homeless population is. Or just people who have lost everything anyhow and have no other bloody option. So what is your view, since you have lived among?
Yes, I have. And that's a great question. This book talks about being homeless. The next one talks about suicide ideation, and the one after that talks about the more esoteric ways to return to normal. So this book is interesting. Yeah, it talks about, there's a lot of hooks, but people want to know what it's like to be homeless. It's a medieval barter system, by the way. It's pretty fascinating. But nobody who's homeless wants to be homeless. It's just not fun.
No.
At all. And just start looking at homeless. They're always talking to themselves. They're schizophrenics. I mean, a whole lot of them are schizophrenics off their meds. Pretty damn simple. Pretty simple. They're schizophrenics who are not taking their meds. There's vets who couldn't readapt after a major TBI, like me, from a roadside bomb, and they have PTSD. Pretty damn simple. 30%. And then a whole lot of them have other issues. Who knows what they are? But very few homeless are there by choice. It's not a pretty lifestyle.
Even if they are, the choices to get out of that sometimes are so overwhelmingly bureaucratic, it's not funny. Even if they could. Access to all the services.
It's
horrid. It's awful.
It's really, well, where are you from?
Originally,
Yeah.
I'm from Australia.
Yeah, I figured.
Yeah.
Well,
we just go out back,
Right.
and do all that stuff. We don't worry about having a roof over our heads, right? Just watch the kangaroos go by. Not being facetious, I just really feel for the homeless.
Yeah, it's a mess.
And anyone that thinks that they're there by choice is probably lacks empathy like you wouldn't believe, in my opinion. Okay.
What can I say?
The other thing too, you said that you obviously felt and were abandoned by your
Absolutely.
family member. But
And so was Michelle, by the way. I followed that case really closely.
Yeah.
So was Michelle.
it's hard. But throughout your presentation, you have also made reference to your sister and your brother and what have you, as if you were still in communication with them, or were those just retrospective comments at the time when you did have a
Well,
relationship?
I'm sure at your age you know friends who've been abandoned by their family. I've forgiven them, but I'm pretty damn pissed off.
Yeah, so you do chat with them?
Well, that's a difficult question. I forgive them, and I try to be an example of someone who forgives people, but I'm pretty damn pissed off. And I got people, my family's pretty damn rich.
Mm-hmm.
I just don't get it. When I wasn't in the will.
Mm-hmm.
Shit, there's 5 kids and I'm not in it. What the hell happened? Was there somebody in my family who told my semi-demented mother that perhaps you should leave him out of the will? Because there's more for us?
Yeah.
I mean, how would you feel?
Oh, all my family's in Australia, and I just don't speak to them, period. It just is the way it is.
Well,
Distance doesn't help.
yeah.
But really, they're
In
We have
my
nothing
in
in
my
common.
brain blown, or in this book here, I talk about my true family, which is not my biological family, right? At the end scene, I go visit my daughter with my true family to reveal who I am, and they're not my biological friend, but they're not my biological family, and that's kind of a tough lesson to learn. You can actually fire your family if need be,
I think it's
which
important to do so.
it'll tear you apart, but the hell, I still don't get it. And when I ask them, they come up with inane reasons. Well, in 3rd grade, you did this, and Dad liked you more than anybody. The hell, I'm homeless, goddammit! The fuck?
Some people are just emotional morons.
Come on, any more questions?
Yes.
Who's gonna put butter in their coffee tomorrow?
Just
I
have,
saw this
him.
on, I think it was America's Got.
CBD, I forgot CBD oil. Hey, can I, so, all right, so if you can remember this, so inflammation, super big problem, especially if you're Irish. We're histamine positive, we inflame like crazy. Xylomen by New Chapter has 10 different things. It's the best on the market. I trust New Chapter, they're third party tested, okay, 10 things, you don't have to take all those things separately. So why would you take curcumin too? Which is curious because there's few Alzheimer's in India, whatever. But there's, cat scratch and cat claw and all these things, boswellian. Just, that's the easy way to take about $1 a day. And yes, I wouldn't say smoking pot is at all good for under 26 brains. It does reduce the hippocampus, which is memory. Please don't smoke pot. I tell my daughter, all you want, I'll give you the heroin after 26. Okay, but you gotta have your brain 26. But CBD oil is, in my opinion, a great anti-inflammatory. So what is CBD? Cannabinoid oil. They take the hemp plant, take the THC out of it, cold press it. Of course, it's a supplement. Oh, that means it's unregulated. Yes, so that's why I say go down to Doherty's, talk to the registered dietitian. But that made a significant difference in my life and my dog's life because it gets rid of my see, I have neurological pain, but I also have inflammatory pain, okay? And I can't get out of a chair, I'm so stiff. And I take that and I can move. That's an inflammatory problem, right? And it also helps my brain, right? So it does help. I've seen people with crazy stuff, like they have restless leg and they take it, it's gone miraculously. I don't know, but it does work. We know it's an anti-inflammatory, okay? So there's all these cannabinoid receptors in your brain, like 200, and when you take cannabinoid oil, there's 65 different cannabinoids. So they don't really know where all this stuff is going. They know about 2 of them, okay? But, it makes people that I know that have cancer and can't eat, they eat. And this is without the THC. Oh, even Marcus sells cannabinoid oil and has for a year. So take that. Neiman Marcus. Yeah, they sell it. So it must be okay. Well, people say, oh, isn't that pot? How could Neiman Marcus? Yeah, I think it's really effective because the inflammatory thing, I think that's super important. Okay, so inflammation, sugar, sleep, big things. And if you can avoid processed foods, it's all bad for you. It's just trash. It's just dangerous as hell. Water, please drink good water if you can. A Brita filter and water in a container, with a plastic container. As soon as you get it warm, the plastic kind of melts and they have hormone blockers. Oof, that's just not healthy. I don't know. There's just so much of this stuff, I don't even know where to start, right? But sugar, inflammation, keep everybody with stress, including my ex-wife. She's got breast cancer. I know exactly what happened. Her mother got Alzheimer's, and bingo, she was the caretaker, and bingo, sure enough, 2 years later, well, a year after her mother dies. It's just so predictable. Sir in the back.
Yes, since you love your dog so much, and
I do.
I love that fact. You might want to go on YouTube and look up, I think it's America's Got Talent. A lady comes on and demonstrates doing yoga with her dog. And that was really neat. The friend who left earlier has got all kinds of medical degrees, and he suggested, he was going to do this, that you address ginkgo biloba. He said that's very good for the brain.
It's what?
Very good for the brain.
Well,
Ginkgo biloba.
I just got to tell you, and this is what I love, okay, so, look, I'm glad you liked the talk I gave, but even better, the last time I talked, this was great. This is what people want to see, okay? One of the doctors got up, there was a couple that were doctors, and she got up, he's a dermatologist, I don't know who she is, and she gets up and she says, I think I said something like, oh, it's changed. Doctors aren't gods anymore, and they can't, just do everything. that offended her, so she turned to the camera and said, "This is bullshit. I'm leaving." That's what you want to see. Don't you? Two doctors throwing eggs at each other, tomatoes? That would be, I was kind of hoping that would happen because,
Okay, I'm gonna be real quick and finish this up.
so actually I'm afraid that, I'm shocked that your friend left without throwing in anything.
Well, his wife actually needed his care, so he went
Oh,
on.
darn it. Okay. I was hoping you could stay around to battle a little bit.
One thing that I would recommend is looking up people who have studied dream interpretation. Dreams are far more important than what we think. They contain information that our subconscious is giving to us that is extremely detailed. It's a fascinating subject. And also, I was going to ask if you can think of any cure for this addictive syndrome of believing that socialism is good.
Gosh,
Those are comments.
I'm gobsmacked. Yes, ma'am.
Yes, you didn't mention lemon juice. I remember years ago reading a book about lemon juice, how we should have lemon juice every single day. It's so wonderful for the body.
I will say that, remember, you have to take cod liver oil. That is very good. That is very recommended for the brain.
Yeah.
Remember, certain oils, the brain is fat, so you need certain oils, right? And cod liver oil is very good. Cod liver oil.
What they used to give you.
Yeah. And if you don't like it, to put it in the freezer. Put it in the freezer for the fishy taste, and then eat it because you won't belch up the fishy taste. So cod liver oil and all those other ones, I won't go into it, but they,
Well, I tried to slip this question in, but I don't have butter. I don't consume butter, but I do have half and half in my morning coffee, and I was going to ask if that counted for my butter quotient.
What do you have in your coffee?
Half and half. It's coffee creamer.
That's a demon, I tell you what. I know you're from Ireland and I've seen plenty of those demon cows. That's the demon thing. There's a lot of controversy over that stuff. I don't like milk because I have lactose intolerance and it makes me cramp. But who thought, butter was like totally off and now it's on. But the interesting thing is it's on because it's feeding certain bacteria, right? Which I just found phenomenally interesting. And I guarantee you your doctor will have no idea what the hell you're talking about, right? So I don't know.
As far as lactose intolerance, I thought I was lactose intolerant until I was at a conference in Denver one time, and some renegades brought a whole truckload of unpasteurized milk over the border from Arizona, and they were selling it off of the dock. I drank an entire gallon. It tasted so good, and I had no lactose reaction at all. And it was non-pasteurized. It was just fresh milk.
Well, this just a quick thing about processing. Okay, so this milk is vitamin E fortified or vitamin D fortified. Well, you've got to understand to do that, they pull all the vitamin D out and all the vitamins out of it, and then put some back in. And that's just the processing thing. It's just the processing in today's food is just not good. I mean, genetically, we cannot handle this. Darwin, bird beads, took 300 years to get to get different birds, DNA does not respond to the radical food changes that occurred in the last 100 years, cannot adapt that fast. 3,000 years from now, we'll be able to eat McDonald's food and stay slim and have no brain fog. It just the DNA can't do that kind of work so quickly.
Yeah, it is important to take a lot of vitamin D. I'm sure you'd recommend that. Also, that being overweight, I was just looking at a chart, how horribly overweight. The state of Texas, I think it said 35%.
Yeah, I could talk forever. So, big body, small brain, proven fact.
Yeah.
Big body, small brain. It decreases the size of the brain. I don't know why, but there's a correlation.
You mentioned about rubbing testosterone cream on your arm, and you feel it increased or two up from 32 points or 40, whatever it was.
I just let me stop there. I'm sensing one of these coming on, but go ahead.
No, well, what I wanted to know, it also said that you felt that estrogen would potentially do the same. You know, for
Well, if
women.
you get, go ahead.
Let me finish. But hormone replacement therapy, which is full of estrogen supplements and what have you, to replace the estrogen women lose after menopause, has absolutely, you know, have enough scientific backing behind it that they're no longer obviously mentioning that postmenopausal if you can avoid it because of the risk to breast cancer and what have you.
And heart disease, right?
And heart disease and all of that jazz, okay? So what makes you think that that's changed in any way? I absolutely believe that it would improve how you feel, okay? Nothing pleasant about getting hairs on your chin when they weren't there prior, I can assure you. And all the other crap that women go through postmenopausally. But what,
Makes me think.
why are you speaking to that?
Because doctors can learn if you give them enough money. So, when the old studies come out about estrogen not being heart protective and breast CA, if you're BRCA positive, what do? Think maybe they should balance out the estrogen with some progesterone and testosterone and some this, that, and pregnenolone. So you're not just getting a simple estrogen. It's much more complicated. It's much more sophisticated. 20 years later, it's much more sophisticated. You're actually going to get a little bit of testosterone, a little pregnenolone, a little DHE, a little this, a little that, and you know, yeah, DHE. That's good stuff. You know, and it's, as far as I know, the women that I know, God, I met. I won't mention names, I guess, but I met a woman I hadn't seen her. Her husband does bioidentical hormones, and I hadn't seen her in 30 years. I was shocked. She looked better at 50 than she did at 20. She was shocking.
There are whole cults of people that believe in that. You take it every day. And,
Yeah, well, yeah, but I think the research backs it.
yeah, as well as people who live on only 800 calories a day as well.
I think fasting is a good idea. That's very, so if you eat just during the day and then you go to sleep and you spend 12 years, okay, let me just give you, let's just break this down, okay? This is what I think. So I'm a scientist, right? And I say, if we've been doing something for 10,000 generations, probably that's a good idea, right? So, I think if you think about what cave people ate, that's not a bad idea. And their pure sugar was from honey, which is guarded by bees, so they're not going to eat that much, right? So maybe some fruits, right? And they ate, what did they eat? They ate some meat, not much. They ate berries, root vegetables, probably not a lot of starches. You see, and they, sometimes there was no rain or whatever, and they fasted, right? And I think those are really good characteristics. So yes, the mice studies say you reduce intake, I think by 30%, or no, you reduce intake like almost by half or 2/3, but they live like a third longer. And that's pretty simple to explain. Look, if you're eating food, which is super hard to digest, you wake up with 100 units of energy in the morning, and you eat McDonald's food, and 50 units are based in trying to break that food down because it's so hard, it's so much work. Well, you're losing, that's a lot of blood down there trying to eat this food when it should be in your brain. I mean, it's pretty simple. When I eat food, I always check, do I have post-eating torpor afterwards? Meaning, if I eat this food, do I get sleepy? Right? And if you eat a lot of meat, yeah, you're going to get sleepy. So I always try to eat food that goes right across the stomach and makes me more energetic. But that's what I would say in terms of paleo diets. Well, the paleo diet I think is pretty sharp. I like it. It makes me, it works for my type, okay? What cave people eat, okay? That and some fasting. So I don't eat after 7, then I eat maybe at 9 in the morning. That's plenty of time, right? I fasted today because I was going to talk tonight, right? it a second. Here's just some paleo stuff. Oh, you can't see this, can you? Take it back. Yeah, look at the paleo stuff. Just think what we've been doing for so long, and we're eating vegetables and roots, and we're treating ourselves with whatever herbs that primitive people can find. You know, quote primitive people.
Well, they also have got a lot of exercise into.
Brain, heart. Everybody will say your brain is as healthy as your heart. And by the way, bad news. Get your heart good before 65, because after that it's really hard to make your heart better. That's a shocker. I heard that at the Center for Brain Health. So, but all the time when you exercise, of course, you know, it's about perfusion. Osteopaths say motion is life. Everything has to move. Circulation, there's 1,000 things in your body that need to move. Right? Yes, sir.
Yes, on the subject I mentioned, do you think this brain freeze on socialism might be helped by reading history books?
CBD oil, probably. Once more. And the paleo diet, I think about it. Is this a liberal group or a conservative group? What do we got here?
Yes, it's a mishmash.
Oh, good, so that you can fight. I think fight.
We do all the time.
That's good.
We're nominally Irish, even though we're
Good. Good. If you don't go to a bar in Ireland and argue with people, no one's going to buy you a drink.
There's a great book called Rebounder. Have you heard of it?
Nope.
It's jumping on a small trampoline that's called a rebounder. Yeah, and it shakes every cell in the body.
Oh, yeah,
So,
but
yeah.
right. So I go to that A4M and there's this machine this big, and you stand on it and it vibrates, and it's $10,000. I was like, what? And I got on it, and I realized, yes, micro movements like that work on 1 million components for the neurological system, right? Including 20 minutes on that, my stomach was shredded. I was like really painful the next day. So micro movements like that, see, doctors don't know this. They entrain the neurological system both centrally and peripherally. And so when we're, like our posture is all micro movements. And when you're on one of those machines, you're training your micro movements. And and it also trains, okay, so if you do micro movements, and by the way, Tai Chi is good, then you're going to be more coordinated. That means you're not going to fall and break your hip and die in a hospital, right? That's what that means. Because that's what happens to people who fall and break their hip. They never come out of the hospital. And Tai Chi, by the way, is really good for that.
I think we're out of questions.
Impossible.
Yes.
Not with this group.
Yes.
No way.
They haven't.
Impossible.
You get to sit down.
Thank you, Tom. Tom's done a great job. I so respect his ability getting out there, marching to Starbucks. Tom, I did what you say out of respect for you. I'm sober. I did this lecture completely sober for you. Thanks, everybody. It's been a privilege.
Where's your dog?
Right here.
Chewy.
Oh, sure. Yeah. You can make the rounds.
Okay, now it's your turn to talk. You get 5 minutes if you want to respond to the speaker had to say either for or against. And who wants to be first? You mean no one wants to talk? I can't believe it. This will never happen.
I could get up a short deal. I can do a short deal.
Take a rip, buddy. John knows what he's talking about. John had the very same experience as I did, and it took him years to recover.
Well, I was just going to mention, I know people who've known me for years, they still don't believe that I've got brain damage, and then others know I have brain damage. So, but, I mean, I had a head-on collision on a motorcycle in '85, and went into this Star Wars slow time. I mean, everything's happening in microseconds. And I received a really violent blow to the head from my wind fairing, but that saved my neck from snapping because my neck was about ready to snap from the impact. And then I flew through the air for about 200 feet. But so anyway, whatever damage I got then, that did cause some strange anomalous things where I had a mild form of hemiplegia, where I had a loss of feeling on one side. And then my right eye was focusing a little slower than my left eye, which caused some interesting artifacting. And on a really bad day, some of that comes back. Most of the time I don't even notice it, but it never completely healed. Then I got poisoned with fluoride at a dentist's office. I think it's called a fluoride bath. They subject mostly children to this, but for some reason my dentist figured that he was being exposed. I was getting wise to his mining for gold in my teeth because he kept finding more and more cavities every time I went in. So anyway, that dropped my IQ down to an incredibly low level. I lost my mathematical tables and had trouble even handwriting. I could barely even write a note. So, I mean, I've been fighting back from that for years. A good detox helped. The first 6 to 8 months were critical. And I did a lot of detoxing, detox teas and so forth. And I got back to where I was functional, but you don't really realize how much you lost until you're trying to do some kind of complicated skill like playing the violin. And I really recommend, I don't know, other than the violin or probably any instrument like playing the piano or something, is going to engage your mind in a way where it's literally creating new neural pathways. And it is reprogramming, refining your brain, and I'm very pleased. It's been a very slow process, but my ability to read music and play music over the years has increased exponentially to where I'm actually in real time seeing all of the information there on the page. I can actually, I'm not like micro-focusing on one part of it. I'm able to see a wider spread. So brain health is a huge issue. If you're using some kind of skill like a musical instrument, it also gives you a feedback, and it tells you where you are on any given day. If you don't have good sleep, if you don't get good sleep, if you had extra stress, and then you go to play the instrument, it will tell you you're not in good shape and you need to ease back, get in a better mood, rest up, and then it all starts coming back. So what Dr. Herlihy is talking about here is very real stuff.
Thank you, John. Yeah, absolutely.
Are you going to speak?
So when I write books, I can tell my ability, because the first chapter in this new book is complete word salad. So I always be able to tell my own abilities by how well I was writing. So that's a nice lab test.
I just wanted to say I appreciate this talk tonight, and I really appreciate the fact that you delved into what was necessary to solve the problem you had. It's like you had a very clear problem, and you figured out how to solve it, and dealt with it, and found out that the so-called standard of care in the medical establishment wasn't very effective. And that's fundamentally my point, because it seems that we're presented with a situation where the government wants to impose some kind of standard of care where the medical establishment with government backing forces you to go through certain protocols to deal with some problem that they diagnose and put into a little box somewhere. And you know, when you're in this box, this is the standard of care. But what really works is figuring out what your your individual body is doing and figuring out how to deal with it, just like you figured out. I mean, you deal with the issue and your body reacts a certain way and you figure out, well, what do I need to do with this? And you figure it out. So it's an individual thing that you have to control yourself and figure out yourself with the help that you can get, rather than having some standard of care imposed on you. And the sooner our government recognizes that we know more about running our own lives than they do and just gets out of the way, the better off we'll all be.
Amen.
Well, health is so interesting. It is so important that we all take charge of our bodies and not just rely. In fact, I've made so many doctors angry questioning them. I remember one time at a allergist, he told me to read some encyclopedial book. I think he was aggravated with me that I wanted to know how I could learn more about allergy. But one time I sold herbs, and there probably is an herb for almost everything, really. I mean, God gave us all different ways to be cured, and we know if we eat healthy that we probably won't get sick. So anyway, I tried to do that with my children, and probably was one of the first people that I know of that gave them liquid vitamin C when they had a fever. It would break a fever, and then of course I discovered a fever is sometimes good to have for a little while. But more and more we are learning that the gut controls so much in our life, and we need to put certain bacteria in our body, and it keeps us very, very healthy, and it affects our brain so much. But the Gerson Therapy book is wonderful. There's so many good books out there to read. Christine Northrup has written great information for women, and she speaks on Channel 13 every so often. We didn't talk about green tea, of course. You can even buy tablets that have equivalent to 4 cups of green tea in a little tablet. And all these things to give you energy, like propolis, is that it, part of the beehive? I used to take that when I went on a trip, and it would give me energy. Anything related to the bees, honey and all, is very, very good. The, what is that one thing that you can get from a beehive? I forget.
Royal jelly.
Royal jelly. Yeah, that'll really give you energy and keep you healthy. But lemon, if we would all probably take lemon juice every day and alkalize our body, and watch not to drink tap water too much, and stretching the spine is stimulating to the brain. Also breathing rosemary, the essential oils, and breathing the oil rosemary stimulates the brain. There are probably other herbs and oils that stimulate the brain. I think lion mane mushroom is very good for the brain, but so many mushrooms are so wonderful for our body. And everybody's body is different, of course, and so you find out what makes you feel good. I know if I get up in the morning and eat a carrot, it just kind of wakes me up. And the Gerson Therapy deals with a lot of carrot juice, which is very, very good for you also.
I guess I'm the last, no one else wants up here? I guess I'm the last one standing. So I want to thank our speaker for doing a terrific job here tonight.
Thank you. Thanks for
You did a great job. It got us all thinking, got us all, the beauty of it is we had very little to say afterwards because we're so impressed with what he had to say earlier, I think. And you take it for what it's worth. There's a...
You can say it again then.
Anyway, speaking of your motorcycle accident, charred my memory. When I was a little kid, I was walking to school and it's on North Avenue in Chicago, and this car pulled out. He pulled out right where the traffic was, and there was a motorcycle coming, and the motorcycle hit the front wheel of the car, and the motorcyclist went over the hood of the car, and he landed on me. And I was his cushion for the ground. He thanked me for being there. I was all blood. But anyway, I went to school. And but I remember that. That was about 12, 14 years old, something like that. And then the only other one there of the same, an Irish, was in Ireland at St. Patrick's Mountain. I was across the street in a pub having a Guinness, and I saw these people walking up the mountain, and they're going for a pilgrimage or something, and they had no shoes on.
Is this St. Crows?
Huh?
This is St. Crows Mountain.
But anyway, and this guy is sitting next to me. I says, "They have no shoes on." He says, "Yes." He holds up his glass of Guinness. He says, "Yes." He says, "More penance, more penance." Anyway, it made me think of that. But your Irish heritage made me think of that. Anyway, I really enjoyed your speech, and I'm going to give it. You get now to comment on the comment that's made here and close this meeting. You get the last word.
Okay. Well, certainly, thank you for the penance that you've done with me, listening to me. Listen, it's so tragic. You know, everyone in my family's in medicine, and I started the scientific path when I was in 3rd grade, so I get it. I speak medicine. But Americans know more about their damn car than about their bodies. It just drives me crazy. So I feel exactly as the blue-shirted philosopher King stated, that's, you know, truly, but how do you actually get really good care? Well, read up all you can, find a doctor that's a little bit more forward-thinking, and there's not many in Texas because the board is very powerful. If you're doing stuff, they're not happy with you. So, that's a difficult thing. Unfortunately, remember that there is now a new anti-aging specialty. They just did the 2nd year in England, so they're like officially, that's their 2nd year. I don't think there's an anti-aging hospital now or a fellowship, but you have to get qualified. But it's coming, but someone like that will know exactly what you're talking about, right? So nowadays, they're certified in this stuff, and they do charge some money. They charge money, so I just thought I'd let you know. I had a lot of $500 cash visits, a lot of those. But I mean, I don't, you know, it's just be your own doctors. Thank you, please, and you know, and I guess fighting about Trump gives you some mental stimulation, so that's probably good, right? And thank you for your attention.
All right.
Well, that's it for tonight. They kick us out of here at 10:30. Our speaker is still here if you want to talk to him.
Oh, yeah, you want to.